Hello everyone. So today we will discuss about the sedative hypnotics. Okay. We will discuss about barbiturates. They are white crystalline odorless powders with faintly bitter taste. Okay. Now we will learn about the classification. The first one are the long acting barbiturates which have onset of action of 2 hours and duration of action is 6 to 12 hours. Few examples are barbitone, methylphenobarbitone and phenytoin. Okay. Now we have intermediate acting barbiturates. The onset of action is half to 1 hour and the duration of action is 3 to 6 hours. Okay. The examples are amobarbitol, sodium amytal, apobarbitol. Now we have short acting barbiturates. They have duration of action less than 3 hours. Okay. The examples are cyclobarbital, amobarbital, seconal or ortal. And now lastly we have ultra short acting barbiturates. The onset of action is immediate and the duration of action is 5 to 10 minutes. Few examples are pentothal sodium, camethyl sodium. Okay. The signs and symptoms of barbiturate poisoning are that they have depressive action on CNS. Okay. The first symptom is the drowsiness, which is then followed by stupor, coma and areflexia. The respiration becomes irregular, sometimes known as can strokes in character, okay, and then finally stop. The cause of death is due to respiratory depression. Okay, there are barb blisters are found in some cases in which the skin at the friction areas and the pressure areas like interdigital clefts, inner aspect of knees, buttocks, calves, forearms contains blisters. Okay, and the blisters contain serous fluid. So these are known as barb blisters. Now the lethal blood levels of various short acting and long acting and ultra short acting barbiturates are as follows. Ultra short acting, the fatal dose is 1 to 2 gram and the blood level is 3 milligram per dl, which is lethal. In short acting, fatal dose is 2 to 3 gram and the lethal blood levels are 7 milligram per dl. And in long acting barbiturates, the fatal dose is 3 to 5 gram and the lethal blood levels are 10 milligram per dl. The few important points regarding barbiturate poisoning are: the first one is the presumptive test for barbiturate, which is a known as Dale-Kopnai test. Okay. Now, forced alkaline diuresis is the useful for treatment of phenobarbital toxicity. There is no specific antidote for barbiturate poisoning. Okay. Now, the barbiturate automatism. It means involuntary suicide. It is the condition seen in barbiturate people taking barbiturate. Okay, they take barbiturate tablets repeatedly because of mental confusion and amnesia, which lead to CNS depression and ultimately death. But they don't intend to take it voluntarily. Okay. Now, truth serum. Also, the barbiturates like thiopental, also known as sodium pentothal, and sodium amytal, that is amobarbital. They are also used for truth serum. Okay. The second we will learn about the chloral hydrate, also known as dry wine. It is also a sedative hypnotic. Okay. It is a colorless crystalline substance which is having a peculiar pungent odor and a pungent bitter taste. Okay. Its principal action is it depresses CNS, that is central nervous system. Fatal dose is 5 to 10 gram and fatal period is 8 to 12 hours. What are knockout drops? Okay, they are given in food or drink to render a person suddenly helpless for the purpose of robbery or rape. So the chloral hydrate works like that. Okay. Now what is Mikefin? Mikefin is alcohol and chloral hydrate, a combination of alcohol and chloral hydrate. It is an example of date rape drug. Okay. The other examples of date rape drugs are alcohol. It is the most common date rape drug. Another is gamma hydroxybutyrate, ketamine, flunitrazepam, that is rohypnol. Okay, and marijuana, cocaine, heroin, benzodiazepines. They are all other examples of date rape drugs.